Thank you, Mr. Speaker, sir, and thank the Minister for his comprehensive statement. Just 3 questions. Firstly, just to confirm, I believe the Minister said that although this was not the protocol previously at the time, but right now it is the protocol that, where, as far as sensitive data is concerned, like personal data in the HIV register, right now, if a public officer exports or extracts or downloads the data, there is an automatic alert that is triggered, and then someone will see that list of download attempts and they'll be subject to some scrutiny. So I just wanted to confirm that is in place right now. Secondly, I think the Minister explained that the individuals such as Dr. Ler, who had access to personalized information from the HIV register, needed that information in order to do their work like contact tracing and so on and so forth. In hindsight, I just wanted to ask the Minister, does the Minister feel that there could be more scope going forward to maybe reduce the number of people who have access to the personalized data to the absolute minimum and possibly even break up access to the entire database between different individuals so that very few or perhaps even no individual has access to all the personalized data, even though other individuals may have access to the aggregated data for the purpose of policy analysis? That's my second question. My third and last question is just based on what I heard from the Minister's timeline, and I'll stand corrected if I misheard this. The Minister mentioned that Brochet was convicted for a sentence of 28 months in jail in March 2017, and he was released in 2018. So I just wanted to check if he did in fact serve the full sentence as per conviction, or the sentence was reduced in length, or was it because he had already served time when the conviction took place? Thank you.
I think on the last question, I can confirm with my colleagues, but I would imagine that it is subject to the normal prison terms where you have a remission of a certain period and then he was deported thereafter. So perhaps my colleagues can confirm. Your question about access, in fact, access to the data has always been on a need-to-know and need-to-use basis, and the number of staff in the MPH actually is very small. They are limited to a handful of people, and whenever they need the information, they will have to then access because they are all doing contact tracing, doing analysis. So all of them are actually working on the similar type of matters. And at the same time, you also would understand that Ler was the head of the unit. So in his particular position, he needs to have an oversight of all the work that his staff is working, and therefore he would have access to all the information in any case. So I think it probably doesn't relate to this particular incident. And the new system that we put in place that has an audit trail, and this audit trail was not meant to watch everybody what it does. There are certain alerts that are built into the system where if there are excessive access to the information, or where there is an unusual kind of access to information, it will be flagged up. And the audit trail will also allow us, when something does happen, to look back. And therefore, I think the overall system, let me just put in perspective, we are actually have to take a multi-pronged approach to data security. The first level is to have system in place to prevent abuse of data, things like encrypted thumb drives and this and that. So those are important, allow us to prevent attempts to abuse the data or illegal access to the data. The second level is for us to detect should something happen and there's some suspicious activities that's ongoing, and these are the audit trails that are important, documentation that's important. And the third level, which is equally important, and that is deterrent. And that is why if we were to find someone who have made illegal access or who have abused the information, who have been less than careful with the information that he's entrusted with, then we must take stern action. And that is what happened to Ler and Brochet. That's why they were charged in court. And only when we do these three will we be able to have a robust system of protecting our information. So if you bear in mind that Ler himself is the head of the unit, the safeguards that you put in place, even if it's effective, he has the right to access. Even if you have audit trails, most of the things that he does from our audit over the last few years when we check what he did, investigate, based on our investigation, they were legitimate work that he was doing with the Ministry of Health. Whether or not he was careful in protecting the data that he was using is a separate issue. So many of these may not be able to stop Ler from doing what he did, but the deterrent is an important part to make sure that those who want to try have to be mindful of the penalties that could be imposed on him if he were ever caught. And therefore, these three must work hand in hand to ensure we have a robust system of data security, protection, detection, and deterrent.